Welcome to the ExtriCARE Dressing Application video. Here are the key products to use for this dressing application video. Step 1. Gather supplies. Dressing kit, pump and canister, gloves, wound cleanser per facility protocol, measurement guide which is included in each ExtriCARE kit, documentation supplies for recording treatment details and wound progress, scissors, skin barrier, and prep. In addition to the supplies mentioned, you may require other items specific to your situation. This video is intended as a general educational overview. Always follow the manufacturer's instructions for use, IFU, your facility's protocols, and any directives given by a physician. Step 2. Prepare the patient. Explain the procedure to the patient. Position the patient comfortably and ensure the wound area is accessible. Step 3. Wound assessment. Before initiating NPWT, the clinician should conduct a thorough assessment of the wound. This includes evaluating the wound size, depth, type, exudate level, and surrounding skin condition. It's essential to identify any undermining or tunneling, as well as contraindications. Documenting the wound's baseline status is also critical for tracking progress over time. Step 4. Cleanse the wound. Clean the wound using normal saline or appropriate wound cleanser. Gently pat dry the surrounding skin. Step 5. Cut and shape the dressing. Cut the foam or gauze dressing to fit the wound without overlapping onto healthy skin. Do not cut foam over the wound. Step 6. Place the foam. Gently place the dressing into the wound, ensuring it fills the wound and contacts all surfaces. Step 7. Apply the ExtriCARE 2-step adhesive drape. Begin by sizing the drape according to the wound's dimensions. If necessary, trim the drape, cutting from blue tape to blue tape along the length to maintain proper orientation. Ensure that the drape extends 1 to 3 inches beyond the peri-wound skin for adequate coverage. Start by identifying the number 1 side of the drape. Gently peel off this layer first, and carefully place the adhesive side down over the wound, smoothing it out to avoid wrinkles. After the drape is positioned, proceed to remove the Step 2 layer along with the blue edges, ensuring the drape is securely and smoothly adhered. Step 8. Attach the tubing. Cut a small hole, dime size, into the drape. Take off adhesive backing and place the dome centered over the hole. Step 9. Connect tubing. Connect the lure lock tubing by aligning and twisting the connectors together. Ensure the connection is firm and secure, but avoid over-tightening. Make sure to smooth out any ripples or fractures around the dome or drape to ensure a good seal. Step 10. Connect to the ExtriCARE pump. Attach the other end of the tubing to the ExtriCARE canister. Turn on the pump and set the prescribed therapy settings. Verify that the dressing slightly collapses, indicating an airtight seal and proper negative pressure application. Once the dressing is fully compressed, it should have a firm feel. This firmness indicates the dressing is correctly applied and the negative pressure is effectively distributed across the wound area. Step 11. Monitor. Monitor patient and equipment. Continuously observe the patient for any discomfort or signs of adverse reactions. Promptly address any concerns to ensure patient safety and comfort. Additionally, verify the proper functioning of the NPWT pump, being alert for any alarms or irregularities. Regularly inspect the dressing to ensure it remains intact, checking for leaks or breaches that could compromise the therapy's effectiveness. Step 12. Documentation. Document the procedure. This includes a detailed wound assessment noting size, depth, type, and condition, the specific size and type of dressing used, exact pump settings, and the patient's response to the treatment, both during and after the procedure. Also, record any adjustments made during the therapy and note the condition of the wound at the conclusion of the session. Accurate and thorough documentation is crucial for tracking the patient's progress and for future treatment planning. That concludes the steps for the ExtriCARE dressing application video. Some important notes. Always follow the ExtriCARE manufacturer's guidelines and instructions. Patient education is crucial. Ensure they understand the importance of maintaining the system's integrity and to report any discomfort or alarms. Assess the wound and change the dressing as recommended, usually every 48 to 72 hours or as per the physician's orders. Thank you.